I am a full-time student, and I also work in a pharmacy. And it's relatively the beginning of the year right now, and for those who are in the middle class, that means deductibles and premiums.
Yes.
Now, the EpiPen, for example, back in 2006, 2007, was around $90. Now we look at the price of the same drug, not made out of gold, although ironically it is yellow, now costs $595.
Yes.
In light of yesterday's debate with Mr. Sanders and Mr. Cruz, how should we take care of these insanely huge deductibles? There's people that cannot afford life-saving medication like the EpiPen, which helps with allergies. If not setting a price range, if not importing drugs from Canada.
Well, we should have drug reimportation, obviously. I mean, I think more competition in the marketplace is better. When people have a monopoly on the EpiPen, it's a problem.
And a big issue with this is that the open market has caused this patent system where any pharmaceutical company, Mylan, Perrigo, et cetera,
No, this is a serious issue. This is a very serious issue, yeah.
What is your suggestion to resolve the growing cost of life-saving drugs? Yeah,
I mean, I think that as populations grow, the period of patent exclusivity is going to have to shrink. So patents have a certain life period that's handed. Congress has the power to license patents for a certain amount of time.
It's 20 years, but the companies can manipulate it to extend that just by changing things scientifically based, like chirality, vectors.
It has to be shortened, particularly in cases where there's really only one type of drug that can be made. Some drugs, obviously, you can make sort of a generic competitor. It's not exactly the same, but it's really close. I mean, you know more about this than I do. But there are certain areas where there's an absolute monopoly on the type of drug, and there you have to talk about shortening the period, because otherwise you're going to end up with monopolies in the market. Like, that's a true monopoly. That's an actual true monopoly.
Daraprim.
Yes, and that's obviously a problem. As far as our health insurance system right now, there's two questions to be had. One is, what does the ideal health insurance system look like, or the healthcare system look like? And one is, how do we get from here to there? And those are not the same question. And I think people tend to conflate the two. So, for example, there's a lot of people right now who have pre-existing conditions. And when I say free market, people think, oh, I'm going to immediately throw them off their insurance, and that means that they're going to die in the streets because I'm saying free market. No, what I'm saying is that we've had a system where, for a very long time, there hasn't been a free market. And so what you have to do is you basically have to say to young, healthy people that you need to make good decisions now. Right? It's on you. You want to buy insurance, you buy insurance. But we're not going to apply to you the same rules we're going to apply to a 65-year-old who's been living under a bad healthcare regime for the last 40 years.
Certain drugs are inevitable, though, like EpiPen. How can you prevent having an allergy?
Right. No, I'm not saying that you can prevent having an allergy. I'm talking about health insurance now. I mean, if you want to talk about the EpiPen and how people get access to it, first of all, I think that there may be, and I think there probably, let's put it this way, there are community solutions that don't necessarily come from government. Meaning that in my community, right, in my Jewish community, people, when there's a health problem, people really put a lot of money into it to help out their friends and neighbors, which is why I talk so much about social fabric. And I say if there's no social fabric, you end up with a growth of government, because somebody has to take care of the people who fall between the cracks. That used to be churches, right? Now it's the government. So, on a long-term level, you want to sort of redirect it away from government and back toward those churches. For now, we're going to have to give subsidies. I mean, that's just reality. I mean, Cruz said it himself last night. Virtually everybody on the right understands. But the question is that a temporary stopgap, or is that your final solution? And I think it should be a temporary stopgap aimed toward eventually eliminating a lot of these subsidies and making people responsible for their own health insurance. Because if you're not, eventually, look, if you're not going to pay for your own child's health insurance, or if you're not going to pay for your own health insurance, then the market attends. If you don't take care of yourself and you don't pay for your own health insurance, you can't penalize people who make good decisions on behalf of people who make bad decisions. It's different for children, I think, than it is for parents, obviously.
All right, thank you. Can I shake your hand?
Sure.